Let's take a look at several cases so that we can see how the CNS Vital Signs and the platform actually works. The first case we have here is a 27-year-old right-hand dominant married 11 Bravo combat infantryman who's an E6. He had a history of multiple blast exposures and 2 grade 2 concussions with post-traumatic amnesia. So he was referred to me for assessment. We did a clinical interview, and then we gave the CNS Vital Signs. Now, the first thing we're going to look at here in the CNS Vital Signs report is, do we have valid test findings? And we do. We can see the VI there. There's a yes by each one of the domains, including the neurocognitive index domain, indicating that we're dealing with a credible assessment. Second thing we want to look at is we have quite a few average scores here, but now we see some low average scores with regard to complex attention and composite memory, and a particularly low score with visual memory, which would suggest perhaps some kind of right hemisphere issue, and also perhaps some frontal issues with the complex attention. In addition to the visual memory deficit that we see there, for example, correct passes on delay was only 10, and correct passes on immediate, the first stage, was at the first percentile. So we have some very low percentiles there. But then look again at the continuous performance test. We see here that actually this is a relatively easy test, and usually someone who's doing adequately will get 40 correct responses. We have an omission error here, which places this patient into the 14th percentile. So it's minimally impaired, and this is something we're going to want to look at more depth at. Also, does this patient have anxiety? Does this patient have sleep disturbance? Is there something else going on in terms of their use of substances? And so we're going to be wanting to look at these other questionnaires that are part of the CNS diagnostic platform in order to determine whether there are other factors going on that may be contributing to this lower continuous performance test and also to the visual memory problem. On the positive side, we don't want to just focus on impairment areas, but we want to also look at this patient's strengths. We can see that the finger tapping test and the symbol digit coding test are pretty strong, that the motor control ability, that the measures of speed of information processing there are pretty good. And so that's a good indicator that there's some healthy functioning here as well. Soldier with some visual memory problems and with some difficulties with impulsivity, we're certainly going to want to do another assessment. We may refer him to some occupational therapy to work on some compensatory strategies for memory management, and we're certainly going to want to reassess this soldier longitudinally to see whether or not, as he's back in CONUS, as he's recovering from the transition from the war zone, where he has probably an overactive mesial temporal lobe area in the amygdala. There may be some amygdala kindling there that are resulting in this impulsivity, that if that changes over time. So we will certainly want to follow this soldier for the next 30 to 60 days, and if necessary, we will go through with a full battery. If he continues to show problems on the CNS Vital Signs, we're going to delve in more deeply with the paper and pencil traditional neuropsychological tests.